Why is tearing during childbirth so common at 85% of all women having a tear of some sort during the birth of their baby? Tearing has always happened during childbirth, whilst the perineum, so that is the skin between the vagina and the anus, is designed to stretch over the baby's head at the point of crowning. Many tears have happened for millennia. Interventions like warm compresses on the perineum have been described as far back as the 1700s to help with the blood flow to the area and reduce the chance of tearing. Doing stitches to bring that tear together has been described in textbooks medically from about the 1800s. It is important to acknowledge though that sepsis and infection, but also postpartum hemorrhage, that's too much blood loss, were common reasons why women sometimes sadly died in childbirth, and part of that would have been due to the complications that can happen with tearing, such as infection and increased blood loss. But we do have to acknowledge that there are risk factors behind why some women are more likely to tear or more likely to have a third or fourth degree tear. These can be individual factors, or these can be system level factors. So one factor is the age of the mother at the time of birth, particularly having a first baby. Women having a first baby over the age of 30 are more likely to have a third or fourth degree tear. And part of this is because our skin elasticality changes the older we get. The average age in the 1950s to have your first baby was somewhere between 20 and 25 years of age. In 2025, this is becoming increasingly later, with the average first baby being born to mums who are 35 and above. Here in the UK, half of all women are having their first baby over the age of 32. And so as that baby's head crowns, if there's not enough skin elasticality, that can increase the chance of tearing. We've also got to think about the additional complications that can sometimes happen with increasing maternal age. Things like preeclampsia, gestational diabetes, for example. We're also seeing more women coming through with type 1, type 2 diabetes. This in itself can impact the size of the baby. 50, 60 years ago, the average weight for a baby to be born at was about 2.5 to 3 kilos on average. Now it sits more around the 3.75 to 4 kilogram mark. That's almost an entire kilo more that babies are being born at, which means bigger head size and bigger body size. Some of that is to do with our diet. We have a much more carbohydrate-based diet than we ever have done. And so babies are growing bigger. But also because of increasing maternal age, it can increase the chance of diabetes, which can increase the amount of free glucose, which can increase baby's size. And all of these factors can mean that there's an increased chance of being recommended or advised to have an induction of labour. Now, system level wise, induction of labour, the rate was set at about 20% in 2010. That is now sitting at about 40% here in the UK. And what induction of labour means is that there is an increased chance of needing an epidural during labour and birth, and an increased chance of the woman being on her back or in a lithotomy position, and also an increased chance of forceps and von Tu's births too. Forceps and von Tu's increases the chance of a third or fourth degree tear, but also you've got to think that that baby's head is coming down far more quickly, not giving enough time for the perineum to stretch, which is why episiotomy is normally recommended for an instrumental birth such as von Tu's or forceps. And with epidurals, there's a higher chance of the woman being told to push. So take a deep breath in, chin in your chest, it's called purple pushing, and pushing that baby as hard as they can, because it's much harder to feel the sensation when you've got an epidural, that it means that that baby needs to come down. There's also an increased chance of fetal distress. And so that fetal distress means that you've got less time to be able to push baby out as well, because of the oxygen requirements required to baby at that time, if there is medicalisation of birth already. And this is part of the reason why home birth has a lower chance of tearing, because firstly, there's a lot less active pushing. Most midwives will not encourage women to actively push, take a deep breath in, chin your chest and push in a home birth, because there isn't the risk factors. There's no induction, there's no hormone drip. Women are a lot more mobile. They haven't got an epidural on board. They are able to be upright, forward, open. They're able to use the toilet and squat, for example, which helps the baby naturally come down and follow their own body as well. They're a lot more in tune with their body too. So it tends to be more sort of fetal ejection reflex as opposed to someone guiding you to push. There's no forceps or von Tu's, and generally the population of women who choose to have home births are technically lower risk. I do hate the term low risk because I think that there is different degrees of risk during childbirth, and what is a risk to one person is very different to another. But at home birth, you are more likely to be looked after and cared for by a midwife, and midwives are far more in tune with women, which will help to guide and protect their perineum during the time of birth. Women have often done antenatal education, and many women who choose a home birth will conduct things like perineal massage too in the antenatal period. Some of them will have undertaken education and hired a birth pool, for example, for the warm water against their perineum. Most of them will have done some degree of preparation to help them with the breathing techniques to help control and slow down that baby's head at the point of crowning. So lots of reasons why women have always torn, why the rates are probably so high, but also from a system level. It's also worth remembering that tears also include minor tears, first degree tears, which are really common. It's just a skin laceration and most of them don't need any stitches at all. This could be a labial graze, for example, or perineal graze. These are ones that often will heal on their own terms and won't need any degree of stitching.